The relationship between religion and psychotherapy is intricate and multifaceted, shaped by philosophical, cultural, and clinical influences. Religions offer diverse perspectives on well-being and healing. These perspectives influence psychotherapy across cultures and faiths. We will uncover points of convergence and divergence. Understanding faith and healing requires a nuanced approach. This exploration sheds light on how faith and healing intertwine. Each religion brings unique teachings to mental health. Christianity offers a framework for understanding guilt and redemption. Islam promotes balance and well-being. Judaism highlights community and support in healing. Hinduism's yoga and meditation integrate into modern therapy. Buddhism offers mindfulness and compassion for emotional regulation. The New Age movement emphasizes holistic healing and growth. These perspectives enrich psychotherapy. Christianity's relationship with psychotherapy has seen both harmony and discord. Evolving views on mental illness and healing shaped this complex history. In the Middle Ages, mental illness was often seen as supernatural. Treatments focused on exorcism and spiritual penance. The Renaissance brought more naturalistic explanations. Today, Christianity and psychotherapy seek a nuanced understanding of mental health. In recent decades, there has been a surge in efforts to integrate Christian principles with psychological practices, giving rise to the field of Christian counseling. This approach emphasizes the spiritual dimension of healing, recognizing the importance of faith, forgiveness, and a relationship with God. Christian counselors often draw upon biblical teachings and theological concepts to guide their therapeutic interventions. They may incorporate prayer, scripture reading, and spiritual reflection into their sessions. Central to Christian counseling is the concept of redemption and transformation. This approach often resonates deeply with individuals seeking to align their mental health journey with their spiritual beliefs. Section 3. Navigating differences. Criticisms and challenges in integrating Christianity and psychotherapy. Integrating Christianity and psychotherapy faces significant challenges and criticisms. Some conservative groups are skeptical, especially when therapy challenges traditional values. Issues like sexual orientation and premarital sex often face resistance. Open dialogue and mutual respect are crucial. Differing views on mental illness and spiritual versus psychological explanations add complexity. Some attribute mental distress to spiritual shortcomings, creating barriers to seeking help. Therapists must approach these topics with cultural sensitivity. Balancing respect for religious beliefs with ethical principles is essential.
Understanding mental health through an Islamic lens. Islam views mental health as integral to well-being. It emphasizes the interconnectedness of mind, body, and spirit. The Quran acknowledges psychological distress and offers solace. Islamic teachings emphasize faith, resilience, and social support. Concepts like sabr, shukr, and tawakkul foster acceptance and hope. Islam recognizes the impact of social determinants on mental well-being. Community and family ties create a supportive environment. Islamic psychotherapy, a blend of tradition and modernity. Islamic psychotherapy integrates Islamic principles with modern psychological practices. It values both traditional healing methods and evidence-based techniques. Therapists are trained in both Islamic theology and psychology. They create a culturally sensitive and spiritually congruent space. Spiritual interventions are incorporated alongside conventional techniques. Practices like prayer and Quran recitation provide comfort and guidance. Section 3. Ethical considerations. Navigating Islamic values in therapy. Islamic psychotherapy offers a valuable framework but raises ethical considerations. Ensuring interventions align with Islamic values is key. Therapies promoting haram behaviors are ethically unacceptable. Therapists must be mindful of gender roles and interactions. Confidentiality is crucial but may need balancing with other values. For instance, breaking confidentiality to prevent harm. Spiritual interventions should align with clients' beliefs. Therapists need a deep understanding of Islamic teachings and ethics.
The Jewish emphasis on mental and emotional well-being. Judaism places a deep emphasis on mental and emotional well-being. The Torah and Talmud recognize the interconnectedness of mind, body, and spirit. Judaism emphasizes the sanctity of life and living a meaningful existence. This extends to mental health, recognizing emotional suffering's impact. Central to well-being is shalom, meaning peace, wholeness, and harmony. Achieving shalom requires inner peace, strong relationships, and right living. Judaism addresses mental and emotional struggles, offering guidance and support. Jewish counseling draws upon Jewish values, traditions, and teachings. It creates a therapeutic space that is culturally sensitive and spiritually congruent. Jewish counselors integrate psychological theory and Jewish thought. Central to Jewish counseling is tikkun olam, meaning repairing the world. Clients' healing is seen as interconnected with the well-being of others. Chest, or loving kindness, emphasizes empathy and understanding. Jewish counselors embody chest, creating a warm and accepting environment. Section 3. Navigating tradition and modernity challenges in Jewish psychotherapy. Jewish psychotherapy balances tradition and modernity. Diversity within Judaism, from Orthodox to Reform, presents unique challenges. Tensions arise on issues like sexuality, gender identity, and family dynamics. Historical stigma around mental illness still affects some individuals. Conflicts between traditional values and modern psychotherapy's focus on individualism. Cultural sensitivity and open communication are crucial. Therapists must navigate these complexities for meaningful support.
Section 1. The interplay of Dharma, Karma, and Atman in mental well-being. Hinduism offers a unique perspective on mental health, emphasizing alignment with cosmic principles for true happiness. Mental distress is seen as an imbalance between thoughts, actions, and cosmic principles. 3 key concepts, Dharma, Karma, and Atman, guide understanding and healing. Dharma refers to one's duty and ethical responsibilities, essential for inner peace. Straying from Dharma can lead to guilt, anxiety, and disconnection from one's true self. Karma, the law of cause and effect, shapes our experiences and future possibilities. Understanding karma empowers individuals to make positive choices for well-being. Atman, the true self, is central to spiritual growth and mental health. Recognizing the interconnectedness of all beings fosters compassion and empathy. Aligning with Dharma, understanding karma, and realizing Atman promote holistic well-being. These principles offer a framework for addressing mental health challenges. Therapists can integrate these concepts to support clients' spiritual and mental growth. Emphasizing ethical living, positive actions, and self-awareness enhances mental health. Hinduism's holistic approach provides valuable insights for modern psychotherapy. Section 2. Ancient practices, modern applications, yoga, meditation, and Ayurveda in psychotherapy. Hinduism's spiritual practices offer resources for mental health. Yoga integrates mind, body, and spirit, promoting self-awareness and emotional regulation. Incorporating yoga into therapy helps manage stress and improve well-being. Meditation trains the mind for greater emotional stability. Various forms of meditation offer different approaches to inner peace. Mindfulness-based therapies, influenced by Hindu practices, emphasize present moment awareness. Ayurveda, a holistic system of medicine, recognizes the interconnectedness of mind, body, and spirit. Ayurvedic principles emphasize balance through diet, lifestyle, and herbal remedies. Imbalances in the doshas can manifest as mental disturbances. Therapists may recommend Ayurvedic practices to restore balance. Integrating yoga, meditation, and Ayurveda enhances mental health. These practices offer a comprehensive approach to well-being. Emphasizing holistic health supports overall mental and emotional balance. Section 3. Bridging worlds. Points of convergence and divergence between Hinduism and Western psychotherapy. Hinduism and Western psychotherapy share common ground in promoting self-awareness and emotional regulation. Hinduism's emphasis on Dharma aligns with therapeutic values clarification. The concept of karma resonates with cognitive behavioral therapies. However, differences in understanding the self and mental illness require careful integration. Hinduism views the self as interconnected with all existence, influencing therapeutic goals. Western therapy may focus on individual needs, while Hindu approaches emphasize compassion and interconnectedness. Different conceptualizations of mental illness impact treatment approaches. Hinduism acknowledges spiritual influences and past karma in mental health. Integrating these perspectives requires sensitivity and respect for both traditions. Therapists must navigate these differences to provide effective support. Emphasizing shared values and understanding divergences enhances therapy. Bridging these worlds offers a richer, more holistic approach to mental health. Integrating Hindu principles with Western psychotherapy fosters comprehensive care.
Section 1. Buddhism's Insights into Suffering and the Human Condition. Buddhism offers profound insights into the nature of suffering and the human condition. Suffering, or dukkha, encompasses physical pain, emotional distress, and existential suffering. Much suffering stems from misperceptions of reality and attachment to impermanent things. Clinging to a false sense of self fuels the cycle of suffering. Buddhism emphasizes cultivating wisdom, ethical conduct, and mental discipline. Understanding the Four Noble Truths is key to alleviating suffering. Ethical conduct creates a foundation of peace and harmony. Mental discipline, through meditation, trains the mind to be more aware and less reactive. These practices offer a path to liberation from suffering. Integrating Buddhist insights into therapy enhances understanding and healing. Section 2. Mindfulness and Compassion, Core Buddhist Principles in Psychotherapy. Mindfulness and compassion are central to both Buddhism and modern psychotherapy. Mindfulness involves present moment awareness without judgment. It helps individuals develop self-awareness and emotional regulation. Compassion involves empathy and kindness towards oneself and others. Compassion-focused therapy emphasizes self-compassion and reducing self-criticism. These principles foster greater well-being and resilience. Integrating mindfulness and compassion into therapy supports holistic well-being. These practices enhance emotional intelligence and self-awareness. They promote ethical conduct and harmonious relationships. Therapists can use these principles to support clients' mental health. Emphasizing mindfulness and compassion offers powerful tools for healing. Section 3. Navigating Secular and Spiritual Perspectives. Criticisms and considerations in Buddhist-inspired therapies. Buddhist-inspired therapies face criticisms and considerations in their integration into Western psychology. One critique is the secularization of mindfulness, stripping it of its spiritual context. This risks losing mindfulness's deeper transformative potential. Another concern is using mindfulness as a form of spiritual bypassing, avoiding difficult emotions. Some emotional pain requires active processing, not just observation. Non-attachment can be misinterpreted as emotional detachment. This can hinder therapeutic relationships and emotional expression. Therapists must use mindfulness and compassion practices ethically and sensitively. Addressing these pitfalls ensures effective and holistic therapy. Integrating Buddhist principles requires careful consideration for client well-being.
New Age spirituality is a multifaceted movement drawing from various traditions. It emphasizes personal experience, intuition, and holistic understanding. Emerging in the mid-20th century, it gained momentum with alternative healing modalities. Central to New Age spirituality is the belief in a universal energy or consciousness. Individuals are seen as spiritual beings having a human experience. New Age practices vary widely, promoting self-awareness and spiritual growth. Common themes include reincarnation, karma, and positive thinking. The emphasis on personal experience distinguishes it from traditional religions. New Age spirituality offers diverse modalities for healing and transformation. It encourages exploring spiritual truths and personal growth. This movement provides a unique blend of spiritual practices and self-help philosophies. New Age spirituality's holistic approach influences psychotherapy. Holistic therapies address mental, physical, emotional, and spiritual well-being. Transpersonal psychology expands traditional psychology to include spiritual experiences. Transpersonal therapies help individuals connect with their deepest selves. These therapies incorporate techniques from various traditions for self-exploration. They may include indigenous healing practices for trauma and spiritual crises. Healing is seen as a journey of self-discovery and transformation. The therapist's role is to support clients in exploring their inner landscape. Creating a safe space for clients fosters healing and growth. Integrating mind, body, and spirit promotes overall well-being.
The intersection of religion and psychotherapy presents a complex and evolving landscape. Religious beliefs profoundly influence how individuals perceive mental health and seek healing. Christianity's emphasis on forgiveness, Islam's focus on balance, Judaism's value of community, Hinduism's ancient wisdom, Buddhism's teachings on mindfulness, and the New Age movement's holistic well-being offer valuable insights. Integrating spiritual beliefs into psychotherapy is challenging. Differing views on mental illness and ethical considerations require careful navigation. Therapists must balance respect for clients' beliefs with ethical principles. Despite complexities, recognizing spirituality's importance in mental health is crucial. Embracing a pluralistic approach creates a more inclusive and compassionate mental health care landscape.